when we get to a place where they're no longer experiencing pain, they don't realize how much mental effort they have been putting into functioning while in pain. And when you get somebody to a space where they're no longer so preoccupied by trying to function in this pain, the amount of incredible, amazing things they do with their life, it just makes your heart so happy.
Welcome back to the Push Pause to Heal podcast. I'm your host, Dr. Emily Rodersheimer. On this podcast, we explore health from the inside out, starting with the foundations, connection, and the conditions that allow the body to heal. Today, I have a very special guest and friend, Dr. Allison Ingley. Dr. Allison is the founder of Core Strong Physical Therapy, a private pelvic floor physical therapy practice in Powell, Ohio, just north of Columbus. She earned her Bachelor of Science in Exercise Science from the University of Toledo and her Doctorate of Physical Therapy from the University of Dayton, and has completed more than 450 hours of advanced pelvic health training. Wow. Her expertise includes pelvic pain, bladder and bowel dysfunction, pregnancy and postpartum care, pelvic floor organ prolapse, and the orthopedic conditions that often overlap with pelvic health. After experiencing pelvic floor dysfunction following the birth of her first child, Dr. Allison became passionate about helping others find the answers and care she wished that she had received. That's how so many of us get started, isn't it, Dr. Allison?
It really, really is.
Yeah.
I have a lot of new to pelvic PT type of people who they're always like, well, yeah, after my first baby, or some form of personal experience. And I was like, yeah, because there is, even when you're in the field and you're starting off in it, there's so much embarrassment, shame, whatever the case is, that it's like, you don't want to talk to people about it. You're like, I'm just going to learn everything there is to know about it and treat it myself.
Well, that's perfect. I love it. I love it. I love it. You know, and I was preparing for this interview. I came up with this theme, which I think will probably just trickle through as we talk. So just to sort of plant the seed for our listener, that just because something's common doesn't mean it's normal. So stay tuned if you're curious about what that might mean. But let's just start off with, I think a lot of people hear pelvic floor physical therapy and immediately think, oh, that's not for me. So let's start there. What actually is pelvic floor physical therapy, and maybe dispel some of the myths around it or the fears?
So I will say everybody has a pelvic floor. So man, women, child, transgender, everybody in between, everybody has a pelvic floor. And in general, it should be one of those parts of our body that we just kind of forget exists. It should just do what it's supposed to do and let us move on with our day. And that's not always the case. And so a lot of the stuff, like a lot of the symptoms that I see with my patients are going to be anything that's happening with your bladder, your bowel, your sexual organs. If you're somebody who's like, oh, I just have this, deep hip pain or this low back pain or this tailbone pain, and I've gone to PT and I've gone to the chiropractor, I've seen the massage therapist, it's not getting better. It's like, yeah, it's probably a pelvic floor dysfunction. Or what we see so often, especially in our male population, is like urinary urgency, urinary frequency, a lot of getting up at night. And, maybe they're a little bit older and they're told like, oh, your prostate's a little bit enlarged, and they want to chalk it up to that, or they'll give them medications and it doesn't really change anything. Or we see a lot in both, in all adults, they might have experienced a UTI at one point in time, and they went through the antibiotic cycle for it and the UTI clears, but they're still experiencing urgency, pain, frequency. All of those are big red flags of like, you need pelvic floor therapy. Like,
got it.
The pelvic floor muscles responded to this. They went into kind of a protective mode. They're usually like overactive in those types of pain scenarios, and we need to get them to kind of calm back down again.
Yeah. So if somebody's listening doesn't know exactly can you tell us, like, what is our pelvic floor? Like, what
absolutely.
Is yeah.
And I have a model, if anybody's able to see.
If anyone's watching on YouTube,
yes.
She's showing us a model, but do your best for the listeners that aren't on
absolutely.
YouTube. Okay.
So basically, your pelvic floor is going to be a group of muscles that go from the bottom side of your pubic bone, which is that bone down low in front of our pelvis, around the genitals, through the genitals, within the
Yep.
genitals, all
Okay.
the way back to the tailbone.
Got
And
it.
so what it's going to do is there's multiple layers. So kind of that first layer is sort of like triangular looking muscle, and then sort of a figure eight looking muscle that kind of goes from the front down the side of the labia if that's what you have, or down the shaft of the penis if that's what you have, through the perineum, crossing over to the other side, going around the anus back to the tailbone, and then kind of reversing that course to come back around the other side. And then deeper to that, we have more of my poor little perimenopausal pelvis over here. Muscles are falling apart. Then we have on the deeper layer, we have this kind of muscle that's more like a sling, and it
Mhm.
goes kind of from your pubic bone, goes back around the anus and back up again, extends back to the tailbone and out to the sides. And together, all of those, the layers of muscles, the different sides of them, they all work together, and they stabilize our pelvis. They are important for pressure management. So, like when we're lifting heavy things, they tighten up to stabilize our sacrum, our hips. They're important for sexual functioning. They have to be very coordinated in their relaxation and contraction to allow for an increase in blood flow to the area, to improve sexual function and orgasms and pleasure. They're important for keeping things in our body when we want them inside of our body, and letting
Yes,
things
please.
go when we want them to come out. A lot of
Okay.
people kind of are, I want to keep everything in, and they forget that
Yeah.
we have a whole host of people who have problems getting things out. And
Yep.
so, whether that's your constipation or your incomplete bladder emptying, so
Mm.
all of these muscles work together. And if you're somebody with a vagina, they are very close to the surface. So, they actually sit within the labia minora. So, they come that close to the surface. With the people who have penises, they come down the shaft of the penis. And that's where we get that rigidity from. And so, they kind of, like I said, they all work together. They do a lot of different things, and it's a really important part of our body. I always tell people, like, if you're having trouble basically between the rib cage to mid thigh, it's probably a pelvic floor issue. There's probably something going on there that we can help with.
Yeah. Well, there's suddenly just this whole world of muscles and things that we weren't paying attention to. We didn't even take into account that are doing a lot of good things for us, or maybe need a little help to do those good things for us. So thank you for that. That very thorough explanation.
Absolutely.
What do you think are some of the biggest misconceptions people have about pelvic floor therapy?
hmm I think that people think that pelvic floor therapy is for two populations: old people and people who have
Mhm.
babies. And that's just simply not accurate. I have people who I see that are in their teens and the early 20s. I have people that I see that are, you know, much older who didn't start having any issue until, 6 months before they see me.
Mm.
And they had babies 40 years ago, type of a thing,
Yeah. Yeah.
And
Hmm.
so, simply because you birth a human or you age does not um, mandate that you're going to have a pelvic floor issue. Those are not the only ways to get here.
Got it. Got it.
Yeah.
Yeah. Thank you for that. So what would you say are the main symptoms if somebody's listening that maybe has a stubborn, annoying symptom? You mentioned like the urinary frequency and urgency. Why don't you tell us some more? Like, what are your main things that you treat?
Yeah. So we personally over here, we see all adult pelvises. So anything that's going on, that's what we see. But what we predominantly see is chronic symptoms. So if
Mm.
you're somebody who, like we mentioned, the urgency and frequency, urinary leakage. So whether that's I can't get to the bathroom on time, or it's a I cough, sneeze, laughed, picked something up type of leakage. Prolapse, so pelvic organ prolapse can show up in with a sensation of like there's this heaviness, or it feels like I'm sitting on something, or feels like things are falling out of me. So that type
And
of a sensation.
prolapse
hmm
means literally that the organ is starting
Yeah,
to
kind of
come
drop.
out. Yeah.
So really what it is basically, there are three in a woman, there's three types of prolapse that we can experience. And so you have your vaginal canal. So the vagina is just the canal. The vulva is everything external to that. So
Mhm.
for people who are listening, like the vagina is not all encompassing of everything between your legs. And so the vagina is going to have a front, a top, and a back to it. So if you have a weakness in the front wall of the vagina, then the bladder can drop down
Mm.
into that wall of the vagina. And so, what you might be experiencing is you might have more bladder type symptoms with that heaviness sensation. And you might see, if you were to look with a mirror, you might see a little bit of like a bubble, almost like things are kind of dropping a little bit.
Okay.
Then you can have like a uterine or a cervical prolapse where basically the uterus is dropping down, and you might have more pain type symptoms. You might have bladder or bowel symptoms, either one. Or you might have, if the back wall of the vagina isn't supportive, then you might have what's called a rectocele, where the rectum is pushing into the back wall of the vagina and is kind of pushing towards the opening of the vagina. And people experiencing that might have difficulty with emptying their bowels all the way. They might feel like, oh, it's there, but I can't get it to come out. They might instinctively try to do splinting, where you basically kind of use your hands either into the vagina or on the outside of the body to kind of give some more support to that, to kind of push that out. Difficulty getting a clean wipe, all those types of things. So that would be the prolapse side of things.
Got it. Got it.
And then we see a lot of pelvic pain and sexual dysfunction. So pain with penetration, pain with orgasm, pain with erections for people with penises, or like maybe that's during the process, or it can occur afterwards. And so where you might be like, I was fine during, but then I have these problems afterwards. We also see a lot of people who have like endometriosis and scarring issues. So C-section scars, or chronic inflammatory conditions where there's a lot of scarring around the abdominal musculature or the pelvic organs of the abdominal organs, that we have to kind of improve that work with. So like I say, really kind of anything that's going on there that you're like, I've been to a doctor and they've told me that there's nothing infected or structurally wrong. If we've gotten to that point and I'm still having symptoms, it's usually worth having an assessment to see if the muscles, or if the issue is coming from a more musculoskeletal place.
And I think your assessment can find structurally wrong things that maybe aren't picked up on a scan or general testing with your primary care type doc. So
yeah.
A
lot of the muscular. Oh, sorry.
No, that's
a lot of the muscle stuff. If something isn't torn, it's not going to show up on imaging. And so that's the hard part. It's not going to show muscles that are overactive and tight, or muscles that are overstretched. It's not going to show muscular imbalance where we have part of our muscles doing way too much and the other side not. And so we kind of go through these imaging, reports, and nothing shows up. And it's like, but as the patient, you're like, it still is a problem. Like something is wrong here. Continue to follow that instinct.
Yeah. And I think I would add to the list, you alluded to it, but constipation, somebody with constipation, it doesn't necessarily, I mean, please try fiber, drink lots of water, start with the normal things. But if it's not going anywhere, then a visit to someone like Dr. Allison would be really helpful.
So I actually love working with constipation. I always say the pelvis is pretty gossipy. It's like this little neighborhood of like old people who are constantly staring out their windows, judging everybody else. Like it's a very gossipy place. And so if you are constipated, constipation can be linked to low back pain, hip pain, pelvic pain. It can be linked to sexual dysfunction. It can be linked to bladder urgency, frequency, and leakage. Outside of just the constipation symptoms itself of like the rectal pain and just feeling so uncomfortable. And so many times what we find with chronic constipation is that when the pelvic floor muscles are supposed to actually relax to let things out, because it has been so painful, or that whole system has been so inflamed and uncomfortable, it actually tightens up in response to that push effort. So it's like you're pushing from the belly, but the pelvic floor is tightening up against it. And now you have this, battle of, greater will of who's going to let go first. And so many times then we end up with hemorrhoids because we're pushing so hard, or fissures, fistulas. And we have some of that type of stuff there where it's like, no, if we can just work with you to help retrain the coordination there, and then work with a functional medicine practitioner to work on the actual gut health and improve the gut motility and the stool consistency and all that kind of stuff, we can get back to a place where it's like, oh, remember when I used to have problems with my bowels? That was a wild time to be alive, but like, thank goodness I don't do that anymore. That's where we want to get to.
I love it. It's so like physical therapy is a no-brainer for people. Like, okay, I have, I don't know, any number of things, but let's say low back pain or plantar fasciitis, doctor recommends physical therapy. Yeah, no problem. I'll go do that. But when we get into some of these other situations, it feels there's a discomfort level because now we're talking about private areas of our body, right? And I know you well, and so I know that you excel at helping someone feel comfort comfortable with you. And I think probably most pelvic floor physical therapists, that's a major goal. Is there anything you want to say or like help somebody? I think maybe even just to understand, like on a high level, what are they going to be asked to do, or what would a visit with you sort of look like?
Yeah, absolutely. So it's really important to me, and it's important within my practice that everybody here is trauma informed care. So from the person who's answering the phone to the person doing the exam, everybody has gone through trauma informed training with a trauma therapist who can like truly say, this is what you're up against, this is what's going on.
Mm,
We need to understand that the pelvis specifically does tend to hold on to a lot of stuff, right? So
mhm.
embarrassment, shame, all that kind of stuff, just around sexuality and body parts in general, not even including people's past experiences of what they have been through individually in their own lives. Um, and so, what's really important for us is that we let patients know the entire time this is what you can expect from our appointment today. First, we're going to sit and we're going to talk about your entire medical history. Everything that you share with me is one of the most important things that we do today. So, if we get to nothing else, hearing your story is massively important for us. We
Mm.
give them the space to share all of the details that they think would be important. And then we ask follow up questions to open up the doors to other things that they might not think is connected. And we help them we
Sure.
kind of walk them through the process of understanding why are all of these things connected. And of course, you'd be feeling the way that you're feeling because of all of these things that we're hearing in your story. Then we do an orthopedic assessment where we take a look at the back, the hips, and the legs, and we see what's going on externally that might be exacerbating the symptoms they're experiencing internally. And then we do the pelvic floor evaluation, at which point in time, our patients will go into a private room. They will undress from the waist down. They will drape themselves in a gown. We always tell them, like, none of that, keep scooting to the bottom of the bed, keep scooting down. Where you're like, I'm pretty sure the only thing on the bed right now is my head, but okay. So we just get them nice and comfortable
Yeah.
on the table. And then we are going to be looking at the rib cage, seeing how that moves. We're going to be looking at the abdominals, seeing how those are coordinated. And then we will talk to them about doing the pelvic floor evaluation, at which point we will basically do the external exam where we look at the pelvic floor, we touch the muscles from the outside to see if it reproduces any familiar sensations of discomfort or urgency to go to the bathroom. And we're going to visually look at the tissue quality to see, I think we might send you back to the doctor for a topical cream to help with this or whatever the case may be. And then we'll go ahead and look at the coordination of those muscles. Like, are the muscles doing what we ask them to do, or do they just kind of sit there not doing a whole lot? And then we'll go ahead and we'll
Yeah.
do the internal assessment where we use a single gloved finger with lubricant and we're just gently touching the muscles internally. We always tell them, okay, I'm going to start off on the upper right side. Is that okay with you? We wait for them to say yes
Mhm.
and then we move. And we kind of go through that whole exam, again, looking for tenderness or urgency and looking at the strength and coordination of the muscles. At the end of all of that, we step out, we let them kind of get themselves put back together. And then we talk about, like, hey, these are the things that look amazing. These are the things that are not quite so amazing. And this is what we can do to work on them at home. And some that at times that includes like a mind body connection thing. Sometimes it's a stretching thing. Sometimes it's a direct pelvic floor technique. It kind of depends on what the
Mhm.
person's comfortable with. And we always lay out the evaluation at the beginning to let them know these are the categories that we're going through. This is going to be the flow of the day. At every portion of the evaluation, I'll let you know this concludes this portion of the eval. This is what I'd like you to do. This is what I would like to do next. You have every right to say, hey, you know what, Allison, that's not on our journey today. Like, I can't get there. That doesn't feel safe to me. That doesn't feel comfortable. And that's fine. It just limits what I can send you home with. I'm not
Sure.
going to sit here
Sure.
and send you home with relaxation if you have an underactive pelvic floor. I'm not going to sit
Right.
here and send
Right.
you home with strengthening if you have an overactive pelvic floor. So we're going to put a pause on that and we're going to address other things. And it's really
Love it.
important for us to kind of explain to our patients that, like, consent is only valid in the moment that it's given. So, for example, if we're back in the treatment room and I
Mm.
say, are you okay if we do this? And they say yes. So we set up the table, I step out, they get themselves on the table, and I walk back in, that consent is no longer valid. I'm going to get it again. Are you okay if we go ahead and do the external assessment? Yes or no. They give me a yes or a no. If they say yes, then we go ahead and we do that assessment. But it's important that they know that, like, you can withdraw your consent at any point in time. And I always tell my patients we're
Yeah.
operating off of two scales: pain and anxiety. So if pain is 0 and 10 is go to the hospital right this second, I never want you over a 2. That's all that's gonna do is reinforce pain signaling to the pelvic floor, and that won't help us. And then with
Yeah.
anxiety, if 0 is I'm perfectly fine with this, and 10 is I'm actively having a panic attack right now. Anything over a 2, which is like, it's a little weird, but I'm interested in the information. Anything beyond that is going to reinforce anxiety signaling to the pelvic floor.
Mm,
That's just giving us a bigger uphill battle. So it's not helping
got it.
us. We're not getting good information if you just power through and do
I
the
love it.
thing, you know? So I try to
Yeah.
make sure that patients
Yeah.
really understand like, we're only doing this if your body is giving us a heck yes, that we can go ahead and check these things. And if not, then that's where we need to
Mhm.
work first. So that's kind of how we do it.
Right, right. Wow. Well, I can feel the intentionality and the care behind every single step that you just walked us through.
Thanks.
And I hope that anyone listening who was maybe fearful feels a little bit more comfortable or safer with this. And like you said, it's just, yeah, I'm curious enough to get this information. It would be very helpful for me. I feel safe. That's awesome. So thank you for explaining that. I think that helps people to understand, why some people maybe don't even think to pick up the phone because they don't know what exactly is going to happen. So I love that you explain that very well. I'm curious if we can talk a little bit about pelvic pain because I think that's one of those things that maybe it's common for some people, but that doesn't mean it's normal. And what you said, I love what you said about like we shouldn't even realize that any of our pelvic floor is really there. It shouldn't be causing pain, and that can be isolating. So what do you wish people knew, that are suffering from pain and haven't reached out?
I would say this. The reason I love working with patients with pelvic pain so much is that when we get to a place where they're no longer experiencing pain, they don't realize how much mental effort they have been putting into functioning while in pain. And when you get somebody to a space where they're no longer so preoccupied by trying to function in this pain, the amount of like incredible, amazing things they do with their life, it's just like, it just makes your heart so happy. Because
Mm,
when we are, unless you have a direct trauma to the pelvic floor, like if let's say you had a bike accident or a sexual assault or something like that, where you had a direct trauma to this area and we are seeing you very early in the healing phase, that's its own category. That is
mm,
rarely the case. More often than not,
sure.
by the time we see people, they have been having pain for months to years and to decades for some people. And so when we're looking at how pain works from like a brainstem, spinal cord, peripheral system, body system,
Neurologic.
thank
Hmm.
you. What we're seeing is that like chronic can sound very scary for people. And I try to encourage my patients to understand that chronic simply means how long pain has been present, not how long it will be present. So if it's been present for 3 months, now it just means that the brainstem and the spinal cord have understood those pathways. They're much easier to send things on those pathways. And so that just means we can't just be like taking a pelvic approach. We need to take a full mind body approach, which means that we need to improve our interoception, which is our ability to sense what's happening inside of our bodies. We need to have an understanding of how do emotions show up in our body. I'm not going to sit here and pretend to be your therapist, but what I can do is that if I have, like for example, I had a patient one time who was postpartum. She previously worked outside of the home, then she had her baby, and her husband decided it was best for a short period of time for her to stay home. And she was having this issue on the one side of her pelvic floor. We were doing a whole bunch of different things to try to get this spot to loosen up. We could not get it to loosen up. So then I was like, okay, we're just going to give this a second. I just started giving some pressure, and I just asked her, I was like, hey, so like, how are you enjoying motherhood? What's going on with that? She was like, oh, I really love it. I'm connecting so much with my baby. It's been so wonderful. And I'm like, okay, cool. How do you feel about like your role as a mom and just showing up in the world? She was like, well, um, I feel like my husband doesn't really value me as much as he used to now that I'm not bringing home a paycheck. So there's an expectation that I am not doing enough because I'm not working outside of the home. And just as she is talking to me about this, I just feel the whole muscle just go whoosh and just let go. And so it was a moment like that where it's like, it doesn't, there are some parts of us that are like you're not stretching your way out of this. You're not going to use manual therapy to get your way out of this. This is something that is connected to your brainstem and your spinal cord. Your body is holding on to this. And so I was able to tell her, I can't tell you how to process what you just told me, but what I can tell you is that this part of your body, this pain, does appear to be associated with your perception of you as a mother inside of your home with regards to the adult dynamic in your home. And so then she's
Yeah.
able to kind of meditate on that or pray on that or think on that, whatever her general flavor of mental health
Sure.
is. She can bring in a mental
Hmm.
health professional if it's a deeper issue, but just helping people kind of understand, hey, this is where your pelvis is holding on to some of these other things that you don't think are associated to your pelvic floor. And then now we're able to get an entire top down, fully restructuring of who you are as a person. And people are able, we've had people who have started their own businesses, left toxic work environments and gotten new jobs that make them like their heart so full of life. We've had people who have left abusive relationships. We have people who have started non-for-profits and done beautiful work in our community just because
Yeah.
not only are they not preoccupied by their pain, but the thoughts that they were experiencing that were leading to the guarding and holding patterns that were keeping them in pain, they are able to have light shed on those, and they're able to handle that however they best see fit. And it just opens up this entire new life to them that they're able to do such amazing things. So that is my favorite thing of hearing,
That
seeing how the body's integrated and helping people just really unleash their genius on the world.
I love that. And you and I both that's that we share that love for, allowing somebody to live their life again in the fullest way that they know how. But if this is a new idea, like I just want to reiterate that there are our emotions do live inside ourselves. Like big, heavier emotions can get stuck or trapped, and pain is a signal. It's your body saying, hey, wait a minute, like we need to look at that. And sometimes there's just a structural thing that needs to be fixed. Sometimes there's a little bit more there. And so that's really amazing. And you're right, the pelvis does seem to be a place where we kind of some of those heavier emotions get stored. So
Well, there was like a
so glad to
really,
know that you're there to help everyone.
yeah. There was a really interesting study that
Go
is,
ahead. Yeah.
yeah, where they basically hooked a bunch of women up to a bunch of surface electrodes, and they just showed them. They wanted to see what does the body physically do in times of stress, and so they showed them mundane images and physically and sexually violently threatening images, and they just wanted to see. Pelvic floor was one of the first three muscles that tightened up instinctively, and so it's like that muscle group is very connected to our fight or flight response. And so when we think about our
Yeah.
fight or flight response, like initially it's there to like keep us safe from like predators, like going to be attacked by a bear, right? But like, depending on how long they
Right.
think the humans have been alive, thousands of years or whatever, like that was always a transient experience. Either you got away from the bear or you got eaten by the bear. But either way, it
Yeah.
ended. And nowadays,
Right.
we're surrounded by bears everywhere. It's, oh, I got to turn that, like, I've got that, got to make that carpool. I got to get that work assignment done. I got to schedule this thing.
Yes.
I got to pay that bill. And there's bears everywhere.
Mm.
And so, if the pelvic floor is so closely tied to that sympathetic nervous system, and we're constantly surrounded by bears, that it is super obvious as to like why some people it's just like it just tightens up, it just holds and
Yeah.
grips.
Yeah.
So
That makes a lot of sense. Yeah. Thank you for that explanation. One thing I noticed is that your practice takes very much a whole body approach instead of just treating symptoms. And that's very similar to how we practice in functional medicine. I think the story you just told us kind of sheds a light on why, but I'm wondering if is there anything else you want to share about why you think that's so important to have that whole body approach?
yeah, I think that I always tell my patients, like, we know very little about the human body, quite frankly. Like, at the end of the day, we know so much more now than we used to, but I don't think, have cracked the surface on that iceberg, right? And so, what we think we know within a few years or 10 years or so, it's like, oh, wow, that was terrible advice. Like, that was not how this works. And so, if we, I think it can be overwhelming as a practitioner to try to know all the things. So we have this kind of like segregation of different fields in specifically in American medicine. Um, but because there's so much to know, it's hard to, when you see patients for 5 minutes, when you have 40 patients a day, like to be able to hear the whole story and how these things are affecting them. We have the luxury here of seeing our patients for so long. We're with them for an hour to two every single time they're in here. And so, in that time, we're able to respect the fact of like, you are a mind, a body, a spirit, a soul, a musculoskeletal system, a nervous system, a lymphatic system. Like you are all of these different systems. And because of that play on the hormones and having conversations with other practitioners who are like when you share with me, just like, hey, the impact of the hormones on the gut health bacteria and how that's going to impact gut motility. It's like, well, I don't do anything with that, but I need to understand that to handle constipation, you know. Or if I'm having somebody who's experiencing erectile dysfunction and I don't have an understanding on testosterone and the fact that you have to have good vitamin D for testosterone to do what it needs to do, then I'm not going to be able to help with the erectile dysfunction. And so it's I have had enough patients that I have worked with where they have told me the craziest stuff and that crazy stuff worked for them, that I'm like, I'm open to anything and I need to be
Yes.
listening to what the patients say because they usually have the answer. Like I had this one lady, just a quick story here. I had this one patient that I was working with and she was coming to see me because her pelvic floor felt so tight. She was like, it's not overly painful. It just feels so tight all the time. And she had a lot of pretty negative relationships in her life and things like that. And we were chipping away at things and she was doing all the stuff I asked her to do. And we were chipping away at it, but it was coming along slowly. She comes in one day and I'm telling you, like initially her pelvic floor, it was like knocking on a brick wall. Like it was very hard. And so she comes in one day and she was like, listen, I've had no symptoms for 2 days. And I'm like, that sounds amazing. Tell me, like, what happened? What'd you do? And she was like, well, I went to see a womb healer. I'm like, I don't know what that means. And so I've never heard of a womb healer before. Tell me more. And she was like, so she walked me through this guided meditation before I went to sleep, where in my meditation, I walked into the woods and I built this fire and I was met by Bear, the womb goddess. I don't know what that means again.
Yeah.
And Bear was spelled, it's like Baer with like the umlaut over the, anyway. And then took
Yeah.
the form
Okay.
took the form of a bear claws, and Bear, the womb goddess, scraped her trauma out of her uterus and dropped it into the fire. This is what she's telling me as part of this guided meditation. And she woke up the next morning and she had no symptoms. And I'm like, so in my brain, I'm like, well, you're obviously a crazy person, but okay, right? That's what I'm thinking.
Right.
And
Right.
I'm like, okay, first of all, I love that for you. I'm so happy that that's what you're experiencing. Do you want to do a pelvic floor evaluation today just to see, are we seeing the same thing in the physical body? And she was like, yes, absolutely I do, because I feel like a crazy person. Like this should not have changed so quickly. I'm like, absolutely. So we go and we do the assessment and
Right.
I'm telling you, it was like nothing had ever happened in her pelvic floor. It was so pliable. It was so mobile. It was so coordinated. Her strength was
Wow.
fantastic. She had zero pain anywhere. And I had no answers. And so it was in that moment that I was like, listen, I have nothing to offer you. You're symptom free. There's nothing that I can find to work on because your body is moving exactly like we want it to. If your symptoms come back, call your womb healer. And if that doesn't work, give me a call. And I was just like, it was such a profound moment of that mind body connection of like,
Mhm.
we could have worked for so long and gradually eventually gotten
Yeah.
there, or she could go the mind body route, which is what she needed. And so it was just this moment that I was like, yeah, we cannot ignore what the mind and the spirit is holding on to and what our body is
Yeah.
energetically holding on
Yeah.
to. It is impacting our physical body so significantly.
Yeah. Well, and I think, you and I are trained as scientists, so we're always
Yes.
like, show us the evidence. How,
Mm-hmm.
where are the studies? But I think the thing I respect so much about you, and I think a lot of people in, similar fields to ours, we have to be curious, right? And we can't say, well, this doesn't make any sense to me that this happened to this woman. So I'm just going to shut it down, judge it, think she's crazy, right? So we could do that, or we could be curious, like, hey, maybe there was something about that this, she was able to unlock some sort of emotional, problem she was holding on to, and then her body was able to heal. So we don't know, but we'll go with it. Like,
Yes.
I'll take all the help I can get with my job. So yeah, if anybody is going, finding other avenues that support healing, whatever it is, it's all welcome, right?
Yeah. Like, do I think we're ever going to get that research on what bare the womb goddess can do for us? Probably not. But
No.
I think an adjacent field might be like, what is EMDR doing for us? What is deep brain
Yeah.
reprocessing or brain mapping doing
Yes.
for us? Because
Yes.
I think that's a little bit more of a controlled environment to be able to study.
Yes.
Now, do I still have patients where I'm like, I think you would vibe with a womb healer. I think that that's where they would want to go. Yeah, I do. But most people, it's like, I think we might want to pull a therapist in to help with us and kind of
Yeah.
work on some of these kind of deeper held patterns that your brainstem and spinal cord are holding on to.
Sure. Yeah, that makes sense. Well, I'm gonna throw a line at you that I wanted to get your response to, because I'm guessing it's gonna be a little bit like nails on the chalkboard, but I think this is just the evolution of how far we've come with this physical, pelvic floor physical therapy. But don't Kegels just fix everything?
Oh my heavens, it is nails on a chalkboard. Thank you for that. Okay, so I will say they can be helpful for a very specific population. Your pelvic floor in general is not intended to work in isolation, right? So therefore, we really don't need to be strengthening it in isolation. And, you know, there's a pretty decent percentage, like 40% of, now this was a study that was done on women, but 40% of women were doing pelvic floor contractions or Kegels incorrectly. 25% of them were doing it in a way that made their problems worse. And so it's like, because it's not something we see, it's not a bicep curl where you can see your arm move and be like, yep, that's my
Right.
bicep.
Right.
There's such little training on what it should feel like, what it should look like, how other things should be working at the same time, that it is not the end all be all. I would say, golly, when was the last time I gave somebody pelvic floor contractions that wasn't like a, freshly postpartum person? I mean, maybe a decade ago. Like, it's just, it more often than not, realistically, it's that the pelvic floor is overactive. So
Yeah.
it's like a clenched fist. So it's holding on too tightly.
Yeah.
And so then when you need it to do more, it can't. So it's like it might feel achy like you would with a clenched fist when you try to stretch it out and shake somebody's
Mhm.
hand. It's going to feel
Mhm.
achy. It's going to feel lacking like coordination. It's going to feel weak, even though it's not. And we just
Yeah.
can get it to a place where it can just kind of like relax a little bit. And then it just does what it's got to do. And you don't
Yeah.
have to think about it. So, like, for example, there's a hip muscle that is very, very closely related to the pelvic floor. It attaches right in, right next to it. And this muscle if you're sitting down, it turns your knee out to the side. It's called an external rotator. So the foot goes inward, knee goes outward. That's what this muscle does. So many times I'll have somebody come in and they test really strong with their hip flexors, which is like raising the knee up in the air, their hip internal rotators, abduction, adduction, extension. They test strong with all of those other motions and they're weak in this one movement. And then we go and do the pelvic floor evaluation. And sure enough, pelvic floor is overactive. It's not very flexible. It's just kind of holding on super tight. I'm like, okay, we'll just kind of take a note of that. We work on relaxing the pelvic floor. Do nothing for the hip, right? We're
Yeah.
not doing any
Yeah.
strengthening for the hip. Just relax the pelvic floor and they can immediately test stronger in their hip muscle.
Wow.
And their hip was never weak. It
Yeah.
was just because that pelvic floor, which is supposed to be an attachment point for it, wasn't giving it a strong place to attach, which means pelvic floor is going to act weak, hip is going to act weak. And so if we were to go and give that particular individual, let's say they're seeing them in an ortho world, they're having hip
Mhm.
pain and they're thinking, oh, we did an image and it looks like you might need to have a hip replacement because you're of a certain age, where
Oh
that's
my
just going to be like a
gosh.
natural finding on an x-ray, right?
Yes.
And so we
Yes.
sit here and we're like, okay, let's contract, let's do more clamshells, and we're strengthening this hip, and like, oh, we can't really get anywhere. And it's like, well, the issue was the pelvic floor the whole time. We just needed to get it to relax and calm it down. And when we do that, all of a
Yeah.
sudden the hip is strong enough. All of a sudden we can stabilize that ball in the socket better. We're not having pinching and catching and arthritic pain. And bingo, bango, bongo, we avoid surgery.
That's amazing.
Yeah. So
And
Kegels are not the end all be all.
I knew I would get you.
I know you did.
Well, and it's just that story is just evidence of like everything is literally connected. Like your body is not, there's no silos within it. Everything is connected and everything's talking to, one part is talking to another, and it's all, so beautiful things happen when we help one area get better. Like there's so much beautiful downstream effects too. Um, so I think we've covered so much today. I'm looking at my remaining questions to see, here's one. I guess if somebody doesn't have any symptoms and is looking to just like take care of their pelvic floor, like, hey, I just want to keep my pelvic floor healthy, what would you say to them?
Yeah. So I actually am a big advocate of having pelvic floor therapy be almost like a PCP type of a thing where like go once a year for a checkup. Just have somebody take a look at it, because I'm not going to sit here and pretend that I look at the same things that gynecologists look at. They don't look at the same things that we look at. They're looking at tissue quality. They're looking for lesions and cancers and things like that. It's incredibly important. I'm just going to put a plug in for gynecologists. Please, people, even if you've had a hysterectomy, please see your gynecologist regularly. There are other forms of cancer that you can get,
Yes.
like vulvar cancers. There's lichen sclerosis, other diseases. Please don't skip the gynecologist simply because you do not have uterus. That aside, but I think that there's such a great, like, because we do like preconception and like
Mm.
pregnancy type of physical therapy to prep for the labor and the birth
Wow.
process. Like there's a lot that you can do to kind of just
Yeah.
catch things
I
and just
love
be like,
that.
hey, I just want to make sure that things are working well, and we can let you know. Like,
Yeah.
you know what? Like we're seeing that this hip is a little bit tight over here. I think when you go and do your workouts, just make sure you're getting in something for this range of motion. You should be good. Call us if you have a problem. Right.
That's amazing.
And then
Yeah.
otherwise, we'll just see you again. And it's like, we can also be those first ones that kind of let you know, like, hey, this tissue is feeling kind of thin and wafy. When you go see your gynecologist next, just have a conversation about topical estrogen. They may
Yeah.
tell you, like, no, you don't need it. You're fine. They're the expert in that. But this is something that I'm noticing was different from last time.
Excellent. Wow.
And that way
Yeah.
we can just kind of keep an eye on the musculoskeletal support
it.
and stuff like that.
I love that. It's an area where we can't really take care of ourselves. We don't know what's happening without
Yeah.
somebody to help. So that's awesome. I love that. And if there's one symptom you've heard people dismiss as normal that you wish everyone would stop accepting as normal, what would it be?
Leakage.
Yeah.
People think that leakage is only an issue if you're having to change your underwear. And I'm like, listen, if you are having any involuntary loss of urine, whether it is a drop, whether it is a flood, that is incontinence. That is incontinence. People think incontinence is only a ton of urine loss. No.
Yeah.
A drop of involuntary loss of urine is incontinence. That should not be happening. Now, I'm going to put a small caveat there. You are immediately postpartum, like in those first couple weeks, first couple days, not even first couple weeks, first couple days. Yeah, that'll probably happen. You're in those giant diapers anyway.
Yeah. Yeah.
Right. You are maybe immediately after a catheterization removal, like a catheter removal, within those first, 2 to 5 days ish. Don't be alarmed if that happens right away. But if it's going on for like, a few weeks, a month, yeah, we've got something we want to address here,
Yeah.
So I will say there are some small scenarios where it's okay for a little bit of urine leakage simply because of medical reasons.
Right.
Other than that, we should not be having urine leakage at any point in time. That, or women thinking that it's okay to experience pain with vaginal penetration. That is not a thing. That is not a grit your teeth and bear it. It's not simply because you are dry. A lot of people think it's just because they're dry, although I will put in my little soapbox for lubricant. Lubricant every time, all the time, always, please, yes, get lubricant. Always. Always.
Is there a brand you want us to check?
So I have a couple good brands that I like. I really like Kindra. They have a water-based and they have a silicone-based. It's a really cool organization run by women scientists, basically, which I really love. The tried and true Slippery Stuff. Yes, that is the name of the brand, Slippery Stuff. It's a water-based lubricant. It is used, we use it in our clinic all the time. It's a good one. Uber Lube is another really good one. Shine lubricant is another really good one. Good Clean Love, we like a lot here. There's a lot of really good ones. What I will say is this, though. I would not just go buy at your typical grocery store. Those usually have a lot of fillers in them. They can, especially if you're somebody who is prone to yeast infections or, other types of pelvic infections,
Sure.
you're going to want something that's a little bit higher quality. It's worth it to just order online from a good company that specializes in making a good quality product.
Perfect.
That would be my recommendation. And also,
Yeah.
don't use an oil, like don't use a silicone lubricant on a silicone toy.
Got
Other
it.
than that, if you're somebody who has long sessions of intimacy, a silicone based or oil based lubricant is going to probably be a better option for you. The water based lubricants are going to absorb into the skin where you might start feeling dry again. And just because your brain says that you want it doesn't mean your body agrees, and vice
Right.
versa. Sometimes your body is saying yes, your brain is saying no. That's where lubricant comes into place, kind of get everybody on the same page.
Okay.
But yeah, longer sessions, we want to probably use more of a oil based lubricant simply
Okay.
because it's going to stay lubricated longer.
Yeah.
But yeah, those are my little
Great. I
tidbits on
can
lube.
link to those in the show notes for
Yeah,
our listener. Yeah. Thank you
perfect.
for sharing that.
Yeah.
Yeah. All right. Well, gosh, I think you've literally taken every question I have and more than covered it. Is there anything I didn't ask that you want to share before we wrap up?
Um, I just that honestly, like pelvic health really is like the gateway to a better life. It really is. If you can get to a place where you not only aren't constantly thinking about your pelvis, but also able to enjoy it. I have a lot of people who kind of get to a place where they used to have painful intimacy and now they're like, well, just, it doesn't hurt anymore. It's like, well, but are you enjoying it? It's like, I mean, it's fine, I guess. It's like, no, you can enjoy
Yeah.
yourself. You can enjoy your body. Um, I would just say that you don't have to stop at symptom resolution. You can go for optimization in the pelvis just like you would, just like what you do in the functional medicine
Yeah.
world. We can go
Love it.
for optimization.
Yes.
And that's okay. You're allowed to enjoy your body.
Yeah. And there is hope. There is
Yeah.
always just when you were talking about chronic just means like what's happened in the past. I love that because chronic doesn't mean that's what you're going to have for the future. If we do take steps to help our body heal and transform, life can be so much better. So I love that, Dr. Allison Ingley. Thank you so much.
Yes.
I have my last final question is because my podcast is called Push Pause to Heal, and I am on a mission to normalize rest for women. I would love to ask, what is your favorite way to push pause?
Oh, yes. So
Mm.
I teach all of my patients tension checks and I do them myself. Now they're much more instinctive for me now because I've been doing this for a long time. But
Okay.
this is basically every couple of hours, just take 5 seconds to tune into your body and let go of whatever you can let go of that is not necessary for the posture that you're in.
I see.
So, for example, if I were sitting like this and I let go and I went like that, well,
Right.
no, that tension was needed for the posture.
Sure.
But if I let go and I feel my belly relax and my posture
Yeah.
doesn't change, then it's like, yeah, you didn't need to be gripping right there.
Mm.
We can let that
I
go. So just bringing us
I
back
can
into our
feel
body.
that already. I think I've already just
Hmm.
let go of a couple things. So I
Hmm.
love that attention check. That's great. And that doesn't
Yep,
take long at all. So thank you for sharing that. And
absolutely.
if our listeners want to learn more about you or get in touch with you, where would you send them?
So our website has tons and tons of information on it. We talk about everything that we treat, what it's like coming in. We also have a great list of our practitioner community. You're on there. If you're looking for a really great therapist in the area, they're on there. Looking
Great.
for personal trainers that we really recommend. There's a lot of good people on there.
Okay.
But yeah, you can reach out to Chelsea, our practice manager, from the
Okay.
contact page on our website or give us a call. We're actually very, very easy to access. I will say our social media is definitely more of a proof of life type of social media. So we are on Instagram and
I get
Facebook
it. I get
at
it.
Core Strong PT.
Okay.
But the
We'd
a
rather
better
have you
place.
doing your work than spending all your time on dancing
Yeah.
around on social media. So
Yeah.
that's totally fine. That's
Yeah, I
totally fine.
appreciate that.
Well, we will link to your website for anyone listening. And this has just been such an honor. Thank you for sharing your wisdom and your compassion with everyone today. I think that we have been able to dispel a couple myths of what's wasn't common isn't normal, and also just make people feel a little bit more comfortable about the conversation of using a pelvic floor physical therapist. So thank you.
Thank you so much for having me. This has been an absolutely delightful conversation, as always, when we get the chance to chat.
That's right.
So I appreciate all the work that you're doing in our community to help women push pause and just not work into overdrive. So thank you for what you're doing.
Oh, I appreciate that. Thanks again.
We'll see ya.